Your dog has a degenerative neurologic disease like degenerative myelopathy. They prolapsed a disc, they have nerve damage. This new treatment may really help. Hello, welcome back to my channel. If you're new, welcome. Click there to subscribe, hit the bell to sign up for notifications, and then when you click the link directly in the box below, I can send you a copy of my free book. First, there's a disease called degenerative myelopathy. DM or degenerative myelopathy, it's much more related to ALS. You actually have degeneration of the white matter of the spinal cord. Clinical signs, we see these middle-aged to aging older dogs, generally medium to larger breeds, and they'll be coming in where they got progressive rear limb weakness. They'll often be knuckling on their rear legs, like where their paws folded under themselves. It's progressive, so they progressively get weaker and weaker. Many clients would come in thinking their dog had hip dysplasia. That's unfortunately not the case, and unfortunately not really treatable. One of my last dogs, his name was Jesse, and I have him in some of the videos, so I'm going to give you a little clip of him here. He had DM or degenerative myelopathy. So this is my older dog, Jesse, here. So what I was finding is he would walk and he would stumble. Or within the last few months, he's gotten especially slow. He's had difficulty going up the stairs, had challenges going down the stairs. And you can see here with Jesse, you bend his paw, see how he's leaving his paw folded under itself? It took him quite a long time. That's a test, and that's called knuckling it. Second, nerve damage from a prolapsed disc. This can affect any dog of any age. More typically, we've got these dogs with these longer backs. Think like a Dachshund. Tula's almost going to fit that profile. They seem to be at higher risk. They can actually have a disc that prolapses out, impinging the spinal cord, the nerves from the spinal cord. And that can lead to something like acute paralysis. They can't even stand up. Just imagine, her legs are flaccid. And I would sometimes see these dogs come into the clinic and they're just dragging their rear limbs. That's also a condition that's really difficult to treat. Either your options are A, get sent off for referral back surgery. A lot of people can't afford it. You don't have access to a specialty veterinary surgeon who can do that surgery. Or try some anti-inflammatories, maybe try some acupressure and kind of hope that, the swelling is going to come down and that the nerves can come back. Turns out help can come from something that looks like this. There's a mushroom that is white and fluffy, looks kind of like that. It's called lion's mane. The Latin name is Hericium erinaceus. I think you pronounce it that way. There are a bunch of studies of lion's mane showing that it has a bioactive agent that induces nerve growth factor. It can actually help nerves regenerate. The one study, which I'm going to link in the description box below, they showed clear benefit for stroke, Parkinsons, Alzheimer's, even depression. They also showed that it can promote functional recovery and nerve cell regeneration. It's not as if this is a new thing. This is a fungi. It's existing in the forest, been used by indigenous peoples for thousands of years. Like, ooh, we're just discovering it. Yet still conventionally, really never heard of it. In that same study, they came to the conclusion that it is safe and free of any adverse effects. It's kind of like potentially big upside, no real downside. There are so many reasons to be using lion's mane. So what about a dose? Well, a standard human dose is about 500 milligrams of the extract daily. You're dealing with about a 160-pound person. So you're going to modify that back. It comes in capsules, so here's the mushroom extract, 500 milligrams. So you got to dose that accordingly. You got your big 80-pound dog. He would be getting about a half of a capsule a day, and you could open these capsules up and then sprinkle on the powder. You've got a dog that's 40 pounds, you're getting about a quarter of a capsule a day. Little Tula, she's 25-ish pounds. I'd be inclined to still give her about a quarter of a capsule a day because it gets harder to break that up. But that being said, they're reporting safe, no adverse side effects, big upside, no downside. I'm comfortable giving her a higher dose, a quarter of a day. So you got a middle-aged to older dog, like my last dog Jessie, being diagnosed with degenerative myelopathy. I really would strongly have you consider trying lion's mane extract. Say a little dog like Tula, right? She's running along, all and she moves, finally pops a disc, and she's got like serious compromised nerves. Perhaps she's got some level of paralysis of her rear limbs. And you're right, and the vet says, like, let's just anti-inflammatories, hope for the best. Really have you consider it, and I would definitely be using it myself, this lion's mane extract. Then how long should you be giving it? Well, I would say a minimum of 8 weeks, more like 12 weeks to assess whether or not it's being beneficial or not. It takes a long time for nerves to regrow, to start to, regain function. It's not something that happens. You give it for a week or so and you can assess the results. But knowing that there are studies showing a clear benefit of lion's mane, it stimulates a nerve growth factor, no adverse side effects, I would encourage you to go for that sort of extended 8 to 12 week regimen. And if you've tried it, you found it to be beneficial on your dog, I'd love to hear your feedback. And if you've got any other suggestions for dogs that have, degenerative myelopathy, have had a disc prolapse and have specific nerve damage, I'd love to hear how you've helped your dog at home. Thanks so much for watching this edition of Veterinary Secrets on using lion's mane mushroom for DM along with nerve injury. Click up there to subscribe, hit the bell to sign up for notifications, and then when you click the link directly in the box below, I can send you a copy of my free book.